Bursal side rotator cuff tear. Patient had positive Job test. On X-ray, the patient had a large acromial spur. MRI shows a bursal side tear on the supraspinatus. On diagnostic arthroscopy we can see that the long head of the biceps, subscapularis and articular side of the supraspinatus are all intact. Going to the subacromial space, we see abrasions on the CA ligament. Subacromial decompression is then done. Identified the tear site and debriding the footprint. Microfracture done to promote healing. Suture anchor applied near the articular side with 8 sutures. Passing of suture using a spectrum. We use the 1331 suture bridge technique. We tie the first knot on the anterior part of the cuff. The second and third set of sutures are knotless. Lastly, tying the last knot on the posterior part of the cuff. Getting all 8 sutures to be placed on the lateral row. Repositioning the sutures for equal tension on the cuff. Checking the integrity of the repair. Checking the intra-articular side of the cuff showing good compression.